Have you ever wondered about the most common dental problems people face and how to prevent them? Well, you're not alone. Millions around the globe grapple with issues related to their teeth and gums, often unsure of the root cause or effective prevention methods. From the young to the old, dental problems spare no one. They range from cavities that stealthily set in, to gum disease that can sneak up on you, to tooth sensitivity that can turn a sip of hot coffee or a bite of ice cream into a wince-inducing ordeal. But why do these issues occur? What are the telltale signs we should be alert to? And most importantly, how can we keep these problems at bay? These are questions worth pondering over. After all, our oral health is intrinsically tied to our overall well-being. Stay tuned as we delve into these issues one by one and uncover their solutions. First on our list, the notorious tooth decay, or as we commonly call it, cavities. Now, what exactly causes these pesky problems? The usual suspects are poor oral hygiene and a high-sugar diet. When we indulge in sweet treats but neglect to clean our teeth properly, the bacteria in our mouth have a field day, producing acids that gnaw away at our tooth enamel. This process, over time, leads to the formation of cavities. And how do we know when we've got a cavity? Well, the symptoms can include toothache, sensitivity to hot and cold, and even visible holes or pits in your teeth. Unpleasant, isn't it? But don't worry, there's good news. Cavities are largely preventable. Regular brushing, flossing, and dental checkups can go a long way in keeping tooth decay at bay. Opting for a diet low in sugar can also help protect your pearly whites. Remember, prevention is better than cure, especially when it comes to cavities. Next up, we have gum disease, a silent destroyer of oral health. Often lurking unnoticed until it's too late, gum disease is an insidious condition that affects a significant number of individuals worldwide. Let's start by understanding gum disease. It's a bacterial infection that targets the gum tissue around your teeth, leading to inflammation, bleeding, and eventually tooth loss. But what causes this oral health menace? Various factors can lead to gum disease, but some of the most common culprits are smoking and poor diet. Yes, you heard it right. That cigarette you're smoking or that sugary treat you're consuming can be a ticket to gum disease. But how do you know if you're a victim of this silent destroyer? The symptoms are often subtle, but they're there. You might experience bleeding gums, especially after brushing or flossing. Ever noticed persistent bad breath or a bad taste in your mouth that just won't go away? That could be gum disease knocking at your door. The good news is, gum disease is preventable. Regular dental cleanings can help remove plaque and tartar, keeping your gums healthy. A balanced diet rich in vitamins and minerals can also strengthen your gums. And let's not forget the obvious. Quitting smoking can drastically reduce the risk of gum disease. Gum disease can sneak up on you, but with proper care, it doesn't have to. Finally, let's talk about tooth sensitivity, a surprisingly common issue. This niggling problem has a knack for sneaking up on us just as we're about to enjoy that first sip of hot coffee or a refreshing scoop of ice cream. Tooth sensitivity, also known as dentin hypersensitivity, is often caused by the wearing down of tooth enamel or gum recession, exposing the inner layer of the tooth, the dentin. This exposure can cause discomfort and even pain when eating or drinking hot or cold foods and beverages. But what causes this wear and tear on our teeth? One common culprit is tooth grinding, often a stress-induced habit. Another is the consumption of acidic foods and drinks, which can erode tooth enamel over time. Now, as for the symptoms, tooth sensitivity is not subtle. If you've ever winced from a sharp, sudden discomfort while consuming something hot, cold, sweet, or even very acidic, chances are you've experienced it. But don't worry, this doesn't mean you're destined for a lifetime of lukewarm beverages and bland meals. Prevention is the best cure, and a few simple habits can help keep tooth sensitivity at bay. Opt for a soft bristle toothbrush to protect your enamel and gums, and consider using a desensitizing toothpaste. Regular dental checkups are also key to nip any burgeoning dental issues in the bud. Tooth sensitivity can be a pain literally, but with the right habits, you can keep it at bay. So there you have it, the 3 most common dental problems and how to prevent them. Let's take a moment to review what we've learned. First, tooth decay, or cavities, are caused by bacteria in your mouth that thrive on the sugars and starches in the food you eat. Over time, these bacteria produce acids that can erode your tooth enamel, leading to decay. The symptoms include toothache, tooth sensitivity, and visible holes or pits in your teeth. But fear not, there are ways to prevent cavities. Brush your teeth twice a day, floss daily, limit sugary foods and drinks, and make sure to visit your dentist regularly. Second, gum disease, often a result of poor oral hygiene, is an infection of the tissues that hold your teeth in place. It can lead to swollen, red, or bleeding gums, persistent bad breath, and, in severe cases, tooth loss. Prevention methods are similar to those for cavities. Maintain a good oral hygiene routine, quit smoking if you're a smoker, and see your dentist for regular checkups. Lastly, tooth sensitivity is often caused by worn tooth enamel or exposed tooth roots. It can lead to discomfort or pain when consuming hot, cold, sweet, or acidic foods and drinks. To prevent sensitivity, use a toothpaste designed for sensitive teeth, avoid acidic foods and drinks, and again, keep up with those regular dentist appointments. These 3 dental problems are common, but with the right care and attention, they are preventable. Regular dental checkups are vital. They help detect issues early and maintain overall oral health. Don't wait until you're in pain to see your dentist. And remember, good oral hygiene habits are your first line of defense against these common dental problems. Brush twice a day, floss daily, and don't forget to replace your toothbrush every 3 to 4 months. Remember, your smile is your best accessory, so take good care of it. Until next time, keep smiling and stay healthy.